This short video is going to be covering problems associated with the arches. We're going to cover three conditions, three arch problems that are common in society. First one is pes planus, or flat feet, as seen here in this image. Pes cavus, or high arches, seen in these two images here. And equinus, we're going to cover a very specific type of equinus, but which is going to be seen here as someone that uses their metatarsals as more of a weight-bearing bone, as is seen in horses. The first type of arch problem we're going to cover is a flat foot, or a pes planus. Obviously, a flat foot is going to be associated with someone that has a lack of a medial longitudinal arch. There's two types of flat foot. There's a congenital and an acquired flat foot. So remember, congenital just means a genetic. It's something that is present with them all the time. Remember from our anatomy video, there's three basic anatomical structures that help maintain the arches. One is going to be obviously the bony support, the bones, which are meant to create an arch with a keystone. The second is the ligaments, which are going to help support and keep those bones nice and tight. The third is the muscles. A large component of the medial longitudinal arch is the posterior tibial tendon, or the tibialis posterior tendon, and that muscle. So any problem associated with any of those three things that someone is born with is going to lead to this congenital or a rigid flat foot. This is going to be relatively rare. There's some things here. This bony changes, if you just think about the bones, the ligaments, and the muscles, like I mentioned, any type of problem associated with those things, there's some stories, some unusual things that I have heard. For example, maybe the navicula doesn't fuse during development, and so a person actually has two naviculas, which I have heard of leading to a flat foot. You might have someone with a really weak or a long posterior tibialis muscle or tendon, so it's not getting the support that it needs. You may have someone with just general laxity, so their ligaments aren't as taut, keeping those bones in place. Any types of those things are going to lead to this congenital or rigid flat foot. Remember, with a congenital flat foot, that flat foot is going to be present with them all of the time. In a non-weight bearing, in a weight bearing scenario, you might have some deviations, but in general, that person is going to almost always have a flat foot as clinically measured with them all the time. Contrast that with our acquired or our flexible flat foot. This can be caused by the same types of problems. The difference here is going to be that oftentimes someone with an acquired or a flexible flat foot, they will have the presence of a medial longitudinal arch in a non-weight bearing scenario. And then when the person puts weight on that foot, they will lose the presence of that medial longitudinal arch. So that brings us to our idea of pronation. So it's this first line here is very important. Pronation is a common portion of walking, of running, of skipping, of jumping, of pretty much every activity we do on our feet. Pronation is going to be an important part of that activity. Remember, when we pronate, it's helping us, it's unlocking our tarsal bones, allowing us to adjust, to conform to the surface. It helps give us some stability, and so it's an important part of our everyday life. However, there are going to be instances of individuals experiencing excessive pronation. So they pronate to the point that they lose that medial longitudinal arch. This pronation, this excessive pronation, is going to result in some internal rotation of this tibia and potentially move on up the chain. Excessive hyperpronation has been linked to several injuries, several conditions. There's just a handful of them here. But remember, pronation is an important part of our daily activities. And so it's about this hyperpronation is the thing that as clinicians we need to begin to be concerned about. Just a quick graphic here demonstrating how that hyperpronation may lead to problems up the chain. If you yourself experience hyperpronation, or you know someone that experiences hyperpronation, you're probably familiar with these or you've at least heard of them. So obviously, if someone has some hyperpronation or an acquired flat foot, they're going to internally rotate that tibia. That internal rotation at the tibia is going to come up here and affect the knee joint. It's going to cause some torsion here at the femur. If we have enough torsion at the femur or enough knock-kneed here, we may have some out of alignment pelvis, which then will affect the spine all the way up, potentially affecting the shoulders or the head and neck position. So you can see quickly how this hyperpronation can be linked to many, many types of injuries up the kinetic chain, and obviously some injuries associated with the feet and the lower leg. A word of caution. Pes Planus, again, you guys that have flat feet or you know someone with flat feet, you know this. Flat feet they're kind of a catch-all as a clinician. You know, if someone comes in with knee pain and you notice someone has flat feet, I have heard very often, oh, well, you have flat feet. Your flat feet are probably the cause of your knee pain. That may or may not be true. Flat feet are an important, or Pes Planus, it's an important observation to make as a clinician. It's an important note to make. It's something that you should not ignore. However, I looked up some sources on this. Flat feet, Pes Planus, is a relatively common condition. Anywhere from 20 to 40% of the entire population is going to experience flat feet or hyperpronation at some point throughout their life for any number of reasons. So with that in mind, it's an important observation to make as a clinician, but I think oftentimes we overutilize Pes Planus as a reason for orthopedic injuries or conditions which may or may not result from the Pes Planus. So just because someone has flat feet, obviously make the observation. However, make sure to do a full and thorough assessment and feel confident that you have taken into account all possible scenarios. So as clinicians, how do we quantify, or how can we measure, or how can we actually decide, oh, this person has a congenital flat foot or an acquired flat foot, and how much pronation do they have? So there's a nice test here. There's many tests. We're just going to go over one. This is the Feislein test. It's a common one. As you guys move on to your respective clinical schooling that you're going to go into, I'm sure that this is a test that you'll go through. I have two videos here. Let's get this one pulled up here. I have two videos here which are going to display two different uses of the Feislein test. And so let's just go ahead and look at these here. So with the Feislein test, you're going to use anatomical bony landmarks in the feet as your guide to decide if someone has flat feet. So I'll pause this here just for a moment. Your first 2 points that you're going to make, the first is on the inferior tip of the medial malleolus. The second is at the distal portion of the first metatarsal. Sometimes people use the joint line between the metatarsal phalangeal joint line as well. It's a little bit of a clinician's preference. And then the third point, we'll let him get there, you're going to use is the navicular tuberosity. So you're going to make those points on your individual in a non-weight-bearing scenario. And then you're going to come and you're just going to make a straight line along the first 2 points that this person made. And you're going to look at that navicular tuberosity. Generally, that navicular tuberosity is going to be in line or slightly below this line made here. Again, how much? So there are clinicians that I know of that would classify this as a slight or a mild congenitive flat foot. So this person's navicular tuberosity is slightly below this Feislein. So some clinicians would say, well, they have a mild congenital flat foot because in a non-weight-bearing scenario they are below that Feislein. So other clinicians, I think, are gonna err more on the side of That's really not outside of the deviation. You guys will see in class as we do this test, many people experience a navicular tuberosity slightly below this Feist line. So anyway, just keep that in mind. So then as we're going to continue to roll through this test, you're going to have the person stand up. You're going to come back. You're going to repalpate those anatomical landmarks to make sure that you still feel like your dots are associated with those bony landmarks. So they're going to feel the inferior tip of that medial malleolus again, the distal portion of that first metatarsal. It looks like he feels like that navicular tuberosity moved slightly, so he just remarked it. And then he's going to go ahead and throw that line up again. You can see easily here that this person experienced some amount of pronation. So we can measure that distance. Some people like to use a thirds rule. I think it maybe depends on your schooling and who taught you. But obviously this person experienced some amount of pronation. So we would say that they potentially have an acquired flat foot as well. Here's another example of the navicular drop test, a little bit different. They use this differently, so we'll go ahead and watch
so
this.
So that the head of the talus is not prominent on either side, then it is said to be in its neutral weight-bearing position. The patient is in the standing position, weight-bearing, and the examiner takes a small rigid ruler and measures the height of the navicular in the normal relaxed standing position.
So again, that's in the weight-bearing position. So they measure from the ground to that navicular tuberosity.
The examiner then measures the height of the navicular in the neutral talus position.
So now this is essentially a non-weight-bearing position. They use the term a neutral talus position. You can use that if you feel confident enough that you have that talus in neutral.
The difference between the two positions is called the navicular drop and indicates the amount of foot pronation present.
So, and then there's some studies out there which have given numbers to the amount of pronation, which then you can classify as someone with a neutral foot, someone with a pronated foot, or someone with a supinated foot. So those are two tests looking at navicular drop, and they both measure the same thing. Okay, so we'll cruise through this. This is the wording on that Feist line test. A quick note about Pes Planus. There's multiple treatment options for someone with Pes Planus. You want to be careful when you go to treat someone with flat feet. If someone has a congenital flat foot and you just throw a huge arch support in there, you are potentially opening a can of worms and creating additional problems for that person. So there obviously are these orthotics. I would start small and work your way up if that's going to be your course of treatment. You can do some exercises, some rehabilitative exercises to help strengthen the muscles in the feet. There's some really cool success stories of people with acquired flat feet or congenital flat feet that strengthen muscles, that posterior tibial tendon, their foot intrinsic muscles, that really see some good benefits and develop a nice medial longitudinal arch. You could have some surgery where they go in and tighten up some of those tendons, or they tighten up some of those ligaments, and they try to give support in other ways to those flat feet. This is the footprints that we would likely see. This is going to be that flat foot. Obviously, we're going to see more of the foot